Comprehensive assessment of the mobility domain in CHC assessment. What is the individual's current level of mobility, and is it stable or fluctuating over time? Are they able to mobilize independently, or do they require assistance from carers or mobility aids? If assistance is needed, what level of support is required, and does it vary depending on the time of day or activity? Do they use mobility aids such as a walking stick, Zimmer frame, crutches, rollator, or rotastand, and are these aids appropriate for their needs? If mobility aids are used, are they being used correctly and safely, and are they in good working condition? Do they require a hoist for all transfers, or can they participate in transfers with support? If a hoist is used, what type of hoist is it, such as a mobile hoist, ceiling hoist, or standing hoist? And how frequently is it required? Are they able to bear any weight during transfers? And if so, how much assistance is needed to support them? Can they follow verbal or physical cues to assist with their own transfers and repositioning? Do they require grab rails, support rails, or additional equipment to aid with movement or transfers? How frequently do they need repositioning, and does this require 1 or 2 carers? Is there a set repositioning schedule in place, and is it consistently followed? Do they have poor sitting balance, and does this impact their ability to sit unsupported for extended periods? Do they require specialized seating, such as a tilt-in-space chair, postural support chair, or pressure-relieving cushion? Are bed safety, rails, bumpers, or protective equipment in use to prevent falls or injury during movement? Have there been any recorded incidents of falls, slips, or trips in recent months? If falls have occurred, how frequent are they? What were the causes and what injuries, if any, were sustained? Has a falls risk assessment been completed, and what was the outcome in terms of risk level? What preventative measures have been put in place to reduce the risk of future falls? Has the individual been assessed by a physiotherapist or occupational therapist, and what recommendations have they made? Do they experience muscle spasms, stiffness, or contractures, and how do these affect their movement? If muscle spasms or contractures are present, what treatments are being used, such as physiotherapy, splinting, stretching exercises, or medications? Is pain present during movement, transfers, or repositioning, and how does it impact their ability to mobilize? If pain is experienced, what pain management strategies are in place, such as medication, positioning, or alternative therapies? Has postural hypotension been identified, and if so, does it affect their ability to stand, transfer, or mobilize safely? If postural hypotension is present, what precautions are in place to manage symptoms, such as slow position changes or increased hydration? Is the individual able to cooperate with transfers and movement, or do cognitive, behavioral, or physical issues impact their ability to engage? Has there been involvement from specialists such as physiotherapists, occupational therapists, or specialist nurses in assessing and supporting their mobility? Have any specialist recommendations been implemented, and are they being reviewed for effectiveness? Are there risks associated with moving and handling interventions, such as the risk of physical injury due to fragile bones, spinal injuries, or other conditions? Has a manual handling assessment been completed? And if so, what guidance does it provide for safe handling techniques? Are specific precautions required to ensure safety during transfers and mobility-related activities? Is there a risk of harm to carers due to complex manual handling needs? And if so, what measures have been put in place to mitigate this? Is the individual's mobility status regularly reviewed to determine if changes in care or equipment are needed? Is the current mobility equipment, such as hoists, slings, or frames, regularly checked for safety and appropriateness? Are psychological factors such as fear of falling, anxiety, or lack of confidence in movement affecting their ability or willingness to mobilize? Has there been a noticeable decline in mobility over recent months? And if so, what contributing factors have been identified? What interventions are in place to slow further deterioration of mobility, such as physiotherapy, strength-building exercises, or postural support? Are carers adequately trained in safe moving and handling techniques specific to the individual's mobility needs? Are mobility-related interventions being documented consistently in care plans, daily logs, and specialist reports? Is a personalized mobility care plan in place, and does it outline specific needs, risks, and strategies to support movement and transfers? Are there ongoing monitoring and reassessment of mobility needs to ensure that care remains appropriate and effective? Does the individual's mobility impact their overall independence and quality of life? And if so, what measures are being taken to enhance their movement and participation in activities? Are there any additional environmental factors, such as flooring, lighting, or accessibility concerns, that may impact their safety and mobility? Are external supports, such as physiotherapy or rehabilitation services, being utilized to improve or maintain the individual's mobility levels? Has input from family or other carers been considered when planning and implementing mobility-related care strategies? Are there long-term goals for mobility, and what steps are being taken to achieve them? Is there a risk management plan in place? To address potential mobility-related concerns, ensuring proactive measures are taken to prevent injury and maintain function. Please share your thoughts in the comment section below.